Welcome back. You're watching McLaren Port Huron's Today's Health, and in this segment we're going to be talking with P.A. Render, a physician assistant who specializes in dermatology with board-certified dermatologist Dr. John Pellicek, and he's going to be telling us all the important prevention tips. Michael, welcome to Today's Health. Nice to have you here.
Thank you for having me.
Can you prevent skin cancer?
Yes, in so many words. And the way to do that, there are specific lifestyle changes that people can adopt, just like you would make lifestyle changes if you wanted to improve your weight. And I'd be happy to go over more of those.
Well, I would like to talk about them, and as soon as you say lifestyle changes, I hear all of our viewers going, ooh, that means I have to do something differently. So what do you need to do to limit your risk?
Honestly, it's very simple. There's no magic tricks involved. There's a certain, number of things that you can do to make things easier for you down the road and to prevent skin cancers. The first thing is that you need to avoid the sun between the hours of 10 a.m. and 4 p.m. Make sure that you don't burn when you're out in the sun. You really need to avoid tanning as well as going to any tanners, because those can really increase your chances of getting skin cancer down the line. When you are in the sun, it's important to make sure that you're protected, that you're wearing clothing, specifically a hat over your head and UV protected glasses. As well as a sunscreen every day, SPF 30 or higher. And when you're out for extended periods in the sun, this is kind of the game plan that I give to my patients, in that it's important to use a sunscreen that SPF 30 or higher every 2 hours. Have it be broad spectrum, meaning it covers that UVA and UVB, and have it be water resistant. Now, say if you're swimming, you got to put it on after you're swimming, because they're very careful in that water resistant. It's not waterproof. That means you have to keep applying it, as well as if you're sweating excessively.
Well, let's talk a little bit about, as you're telling me these things, and Dr. Pellicek told us in a previous segment that skin damage is cumulative over your whole life. So let's talk about our kids and the practical aspects of preventing skin damage for our children.
It's tough. I know kids can be squirmy sometimes, and they won't be easy they won't let you put on sunscreens easily. But these days, you really have to act on behalf of your kids. You have to make the right decisions for them, because they won't make them for themselves. And these days we have a lot of different types of sunscreens that you can use to make it easier, because they don't want to sit for long periods of time to rub on the sunscreens. I tell my patients that they can use sprays.
Okay.
And they even make like deodorant type sticks of sunscreen that are pretty easy and quick to put on.
So the kids can even help put them on themselves.
Yeah.
And rub them in a little bit themselves, but you still have to supervise.
Exactly. And kids actually really do like to use the sprays. They like to play around with it, and sometimes they end up putting on way more than they need to, but it gets them into a good habit of using their sunscreen.
And the rule is still the same, every 2 hours?
Yes.
Or right after they've been in the water, they got to be doused again?
Absolutely, and with kids I'd be even more vigilant, because they're young and they're growing and their skin is still developing as well, meaning that they are more vulnerable.
Yeah, and that's, like you said, sometimes that's hard to do. I'm wondering about a couple of things. Do the swim shirts and things like that they sell, and they say, oh, wear this swim shirt in the water, do those work?
Do you mean the clothes that are SPF protected?
Yes.
Yes. They do offer a little extra benefit in that they block out more of those UV rays. Have you ever seen anybody go to the beach before and they wear a white shirt and they notice that their skin's a little bit more tan through it? Exactly, because you can still get the burn, you can still have your skin get damaged through your clothes.
So you still, if your child wears one of these swim shirts, he's protected, they still need to have sunscreen on underneath it?
Yeah.
Okay.
Yeah.
And how about sunglasses for kids? Are those important?
Especially, yeah. And it's important because I know the cheaper ones, they won't have that UV protection, but you really need to look for sunglasses that have that UV protection.
Very good reminder for all of us to take care of our skin, but especially kids. Do you have any closing comments for us?
Absolutely. I tell my patients that it's important to notice that if you notice something new on your body that you've never had before and it just doesn't quite look right, Dr. Palachuk has already gone through different signs and symptoms of skin cancers, but really it's important that if something's new and it doesn't look right, it's okay to get it checked. There's no harm in knowing that something's safe or if it's not.
Thank you so much for joining us, Michael.
Absolutely. Thank you for having me.
And thank you for joining us. We hope that you've gotten a lot of good information today and start making those lifestyle changes. If you have any questions about anything we've talked about, you can call us at Health Access. That's 1-800-228-1484, or you can go to our website, mclaren.org/PH Contact. You know, if you want a copy of this program or just some great, reliable healthcare information, go to our website, mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.